Hi everyone, this is my presentation on social prescriptions, a holistic and individualized approach to healthcare. To start, most of the United States healthcare still falls into the traditional biomedical model of health, which is outdated and inferior compared to the biopsychosocial model. The biomedical model focuses on treatment that aims to change the body's physical state. It has been seen as only the responsibility of those in the medical profession to treat illnesses because the disease is the result of biological changes beyond the individual's control. So here I've provided a table that simplifies the differences between biomedical and biopsychosocial models of health. To elaborate, the ideal biopsychosocial model of health focuses on an individual's perception of their symptoms and how they and their families respond to the symptoms they are experiencing. As the name implies, health is perceived through a biological, psychological, and social lens. The patient is prioritized, improving patient care, compliance, and satisfaction. The biopsychosocial model of health can also be defined in philosophical and practical terms. Philosophically, it is a way of understanding how suffering, disease, and illness are affected by multiple levels of organization, from the societal to the molecular, which means care must analyze the many dimensions of well being by holistically treating a person. Then, at the practical level, biopsychosocial treatment must consider the patient's subjective experience and individuality. Hence, the biopsychosocial must prioritize
Individualized care.
Let's talk about holistic and individualized care in more depth. In recognizing the interconnectedness of physical, mental, and social health, the benefits of holistic treatment are evident. For example, volunteering, a social activity, promotes positive mental and physical health. In doing good work, there is a sense of achievement, boosting one's self esteem and pride, and connecting with others reduces a key risk for depression, social isolation. Additionally, this community engagement is especially valuable for older adults as a lower mortality rate is associated with volunteering. Research supports reduced symptoms of heart disease and chronic pain for individuals that volunteer regularly. So, it is clear that volunteering, which directly impacts one's social health, indirectly impacts mental and physical dimensions of health as well. The relationship between physical, mental, and social health operates in every direction. Another example of health's multidimensional nature is stress. Although a psychological response, stress can be felt physically through headaches, trouble sleeping, weight gain, and muscle pain. And socially, it may be overwhelming to make time for friend and family commitments, therefore infringing upon those relationships. In general, holistic health is about looking at a person in their entirety, including all dimensions of their health beyond the medical realm. Only then can healthcare professionals provide effective treatment. Additionally, there is no doctor knows best. How could they? Service is about people working with people, people from different backgrounds, with voices, opinions, and judgments to share. People with hobbies, interests, passions, and quirks. People with a variety of reasons to smile, improve, and achieve. Individualized patient care acknowledges the patient as a person. They are the center of their care, a type of care that gives attention to the patient's needs and priorities. With services that are tailored to the specific needs of an individual, their families, and their communities, patients have control over their health and well being. They are empowered and supported by effective and efficient health services. Therefore, health outcomes are improved and unwanted, unnecessary care is avoided. Healthcare is not one size fits all, it must be individualized. So, how can the United States healthcare system successfully implement the biopsychosocial model of health, including both holistic and individualized care? The answer is social prescriptions. Social prescriptions are non medical treatments that aim to address the social determinants of health. Like medical prescriptions, healthcare professionals may use social prescriptions to formally refer patients to a variety of community resources as a form of treatment. Factors of an individual's everyday life, such as income, education, conditions of employment, housing, residential environment, social capital, social exclusion, and early life, are key elements to one's health. They have positive and negative influences on health, influence that must be acknowledged as its impact may be greater than genetic family history or behavioral risk factors. The United Kingdom is already making impressive efforts to address the social determinants of health with social prescriptions. In specific, link workers, a part of primary care networks, provide access to community based resources and services, acting as a link to options beyond the medical realm. They offer people a more holistic and individualized treatment, taking the time to recognize every dimension of health and listen to what matters most to their patients. The United Kingdom's National Health Service plans to connect more than 900,000 people with community groups and services for practical and emotional support by 2023-24. Social prescriptions encompass a wide variety of practices. Two that have received attention by researchers for their holistic nature are singing and museum attendance. Studies have shown how singing can reduce symptoms of postpartum depression. Singing for a mother is an enjoyable and creative experience. It facilitates a sense of achievement and identity, soothing the baby while enhancing the mother infant bond. And think about if doctors could prescribe 30 minutes of music and singing time in the morning and before bed, similar to a dentist recommending their patients brush their teeth twice a day. Socially, the mother infant relationship is nurtured, and mentally, the mother will feel more positive. Furthermore, museum attendance supports the prevention of dementia as a mentally engaging, enjoyable, and socially interactive activity. Adults 50 years or older who visit museums are associated with lower rates of dementia over a 10-year follow up period than those who visit museums less frequently. The aging population in general provides the perfect opportunity for the implementation of social prescriptions as a holistic look at health. Mental health illnesses are very prevalent among older adults, with more than one fifth of the older population having some mental disorder. The most common is depression, which is associated with distress, suffering, and loneliness. It is encouraging to know that 80% of cases are treatable, but unfortunately, depressive disorders are consistently underrecognized and two-thirds go untreated. Healthcare professionals tend to hyper focus on older adults' physical changes and illnesses and fail to recognize their mental conditions. Change is needed. Healthcare professionals must look beyond the biomedical model and recognize the benefit of social connections and intimate relationships. Depression is normalized with age, but community participation to satisfy social needs and in turn positively impact mental health can help reverse the pattern. Next, social prescriptions exemplify individualized treatment through organizations like Dress for Success and Phone Connect. Consider the saying "dress for success." To many, the phrase means wearing a more presentable or appropriate outfit to take an important test or to speak to a group. It is a quirky catchphrase, but clothes truly do tell a story. For this reason, the nonprofit organization Dress for Success strives to empower women towards self sufficiency and economic independence by providing professional attire. Arriving at an interview looking confident and capable, as well as equipped with developmental tools and a support system, women can advance their careers and reach their dreams. Women can lead more balanced, safe, and enriched lives, positively influencing families, communities, and societies. Sometimes it begins with dressing for success. Most recently, during the COVID-19 global pandemic, many healthcare services embraced virtual platforms which rely on phone and internet access. More people were able to connect with their healthcare and social services, stay up to date on relevant information, and adhere to public health directives such as social isolation and contact tracing. For those without access to the digital world, though, a disadvantage arose. This digital health inequality warranted a response, and physicians at the University Health Network in Toronto, Canada, initiated a program called Phone Connect. Phones were provided as healthcare intervention, a perfect example of the usefulness of social prescriptions. Another example of social prescribing is responsible for my passion for the practice as a whole. Last semester, I studied in London and interned with Core Arts. Founded in 1992 by an artist, Core Arts was housed in a vacant hospital. The first studio was a space open to all patients seeking refuge from the redundancy of life in the psychiatric ward. Art was an escape into a world of color and free expression. Patients benefited from the creativeness, and after several successful exhibitions, others saw the advantages of art as well. Today, Core Arts offers more than 85 classes in 5 departments, including the arts, music, multimedia, horticulture, and sport. The mission remains the same, promoting positive mental health and well being through creative learning. Members have access to sessions and workshops run by professional tutors in a safe environment where effective individual guidance and support are the standards. Through Core Arts, people who experience mental health issues are empowered to overcome barriers, fulfill their potential, and participate fully in their community. I saw firsthand how access to a community resource such as Core Arts benefited so many individuals who previously struggled alone, and their services were prescribed by healthcare professionals. Now let's discuss the steps that have been made in the United States to implement social prescribing. Healthy People 2030 is a set of national objectives for health and well-being upon entering the next decade. One of their 5 overarching goals focuses specifically on the social determinants of health, aspiring to create social, physical, and economic environments that promote attaining the full potential for health and well-being for all. It starts with action from public health organizations and their partners in sectors like education, transportation, and housing. For this reason, the National Center for Chronic Disease Prevention and Health Promotion is working beyond the biomedical model. They recognize the importance of achieving health equity by addressing the social determinants of health and have outlined many incredible community initiatives. They conduct high quality surveillance and focus on upstream, evidence based interventions. For instance, the CDC's Healthy Tribes initiative perfectly encompasses the holistic and individualized nature of social prescribing. In partnering with American Indian and Alaska Native communities, the Healthy Tribes program is working to increase access to traditional foods, promote food sovereignty, and maintain sources of fresh, healthy, and locally grown food for purchase on the reservation. So, in strengthening the American Indian and Alaska Native communities' cultural connection, their health is improved and disease prevented. And healthcare professionals, with the use of social prescribing, may refer their patients to programs like Healthy Tribes. Other examples exist of successful National Center for Chronic Disease Prevention and Health Promotion programs are heart disease and stroke risk factor screenings for low-income women aged 40 to 64, and access to timely breast and cervical cancer screening, diagnostic, and treatment services. More locally, the University of Wisconsin Health Northeast Family Medical Center has made progress in understanding the social determinants of health and their role in managing chronic diseases. Since 2016, their clinic has partnered with the Community Resource Navigator program, which employs student navigators to connect patients with community resources. Patients are given the opportunity to meet with social, financial, and legal organizations to address their non medical needs to improve their health and well being. The future is now. The biopsychosocial model of health must be made a reality, and social prescriptions are the answer, providing holistic and individualized care. I hope you enjoyed my presentation. Here are some discussion questions. Enjoy! And finally, I've included my references.